Hi, I'm Vidya, studying Bachelor in Medical Imaging, cohort 4 in cafeteria senior. And today I'm going to present about reproductive system, that means HST, which means the examination of uterus and fallopian tube by using radiography with the injection of contrast media. Okay, let's see. This is the anatomy part of female reproductive system. This is the front view of fallopian tube, and this is the ovary. Here is the ovary, this is the fallopian tube, here is the cervix, and here is the vagina. Explanation on the suspected indication. Indication suspected retrovision of uterus. Symptoms. The patient have pain during menstruation, pain in vagina, urinary tract infection, UTI, that means increased urinary frequency of feelings of pressure in the bladder, and mild incontinence. Endometriosis, the causes may be because of the suspected retrovision. There must be causes. Endometriosis, endometrial scar tissue can cause the uterus to stick in a backward position. And there is a fibrous, uterine fibers can cause the uterus to become stick or misopen or tilt to backward. And patient may also cause PID when left untreated, can cause scarring, which may have similar effect to endometriosis. Explanation on the suspected indication again. This is the normal position of the uterus, and here is the retroverted uterus. That means the uterus is moved to the backward. A retroverted uterus is a uterus that curves in a backward position at the cervix instead of a forward position. A retroverted uterus or tilted uterus is a normal genetic condition that does not affect your ability to get pregnant. Here are the procedures. This is my patient details, and there is the before procedure, patient preparation before procedure. Make sure this procedure done between 6th to 10th day of LMP. Ask patients LMP. Ask about any allergic to seafood or contrast media. Ask patient to remove any opaque objects from patient's body. Ask patient change into hospital gown. Patient should bring her sanitary pad along with her. Equipment that we are using here is the equipment fluoroscopy machines, vaginal speculum, vacillum forceps, HST tray, uterine cannula, Rich Wilkinson cannula, teniculum, sconator teniculum, straight double tooth, omnipack, that means contrast media, incontinence pad, preparation trolley. These are the image that can be seen. This is the vaginal speculum, this is the fluoroscopy, and this is the HST test. Patient care during the examination. Okay, the procedure should be performed during the proliferative phase of the patient's menstrual cycle, days 6 to 12. When the endometrium is thinnest or after the menstrual 6 to 12, as I mentioned earlier, the LMP should be between 6 to 12. The patient should be abstain from intercourse between booking the appointment and the time of examination. Patient may be instructed to take mild pain reliever before the examination to alleviate some of discomfort associated with cramping. Patients should be instructed to empty the bladder before the procedure. Inform to physicians of any medication be taken and if there are any allergies. Inform the doctor about recent illnesses or other medical conditions. Ask the patient to bring own sanitary pad, remove some or all of your clothes, and to wear a hospital gown during the exam. Okay, this is the shielding that we are giving to the patient. That means a thyroid shield. The thyroid shield given at the thyroid part only. Ensure that shielding is not obscure pelvic area. And this is the radiation protection that wear by radiographer, doctor, and staff nurse. Lead gown and the thyroid shield. Explanation of during procedure and post procedure. Patient lies on fluoroscopy table using the fluoroscopy to take an AP scout image at the pelvic cavity. After take a prelim film, patient had been positioned into lithotomy position to take another image using the contrast media. Speculum was inserted into the vagina. It holds the walls of vagina part to allow the cervix to be viewed. The genital area is cleaned by using antiseptic solution. Insert the contrast media thin plastic tube with a small balloon. Pass into the cervical opening. Small balloons keeps the tube in place in uterus. Speculum insertion. This is the way of how they are inserting the speculum. Open the vaginal orifice first, and then the vaginal speculum is inserted, and then vaginal speculum in place. They will enlarge the vaginal speculum so that the vagina is opened and they can see the cervix clearly. Explanation on during procedure and post procedure. Speculum is then removed and patient is placed in a slight Trendelenburg position. Syringe filled with contrast media is attached to a balloon catheter. Care must be taken to expel all air bubbles from syringe and cannula as this would cause confusion in interpretation. Contrast medium is injected slowly into the uterine cavity under intermittent fluoroscopic control and image will be obtained. After image is obtained, cannula or tube is removed from the cervix. Explanation on post procedure. Ensure the patient is not in serious discomfort or significant bleeding from the patient leaves. Patient advised that she may experience vaginal spotting. That's why they asked her to bring own sanitary pad and pelvic cramps for 1 day after the procedure or may persist up to 2 weeks. Ask patient to change into her own clothes. Okay, this is the AP scar image obtained 24 by 30 cm fluoroscopy image. The center ray and ID center to a 0.5 cm superior to the. Okay, next. AP image contrast, the contrast media exiting the distal uterine tubes into peritoneal cavity. This is the peritoneal cavity and can see the exiting of the contrast media in the from the uterine tubes. And there is a right side marker here. Image analysis, pelvic ring seen on AP projection center within collimated field, cannula seen within the cervix, and opacified uterine cavity and uterine tubes are seen center to the IRI. Contrast media is seen within the peritoneum. Appropriate contrast and density demonstrate anatomy and contrast media. Right marker is shown without superimposed to the ROI, that is region of interest. Diagnosis here, retroverted uterus seen in radiograph image, uterus curved in a backward position at the cervix instead of a forward position. You can see there is a exiting of the contrast media in the peritoneal cavity. That means there is no abnormalities in the fallopian tube. But can see the uterus that moving backward. Okay. Okay, these are the reference that have been used. Can search from here also. And thank you very much for watching.